The importance of patient safety in healthcare system cannot be downplayed. Patient safety is a fundamental principle of healthcare, and it's now being recognized as a large and growing global public health challenge because the global landscape of healthcare is changing with health systems operating in increasingly complex environments. While new treatments, technologies, and care models can have curative potential, they can also pose new threats to safe care. Incidentally, the World Health Organization says global efforts to reduce the burden of patient harm have not achieved substantial change over the past 15 years, despite pioneering work in some healthcare settings. And more than 50% of this, the World Health Body says, is preventable if concerted efforts and requisite investments are put in place. Global Health Digest this week draws attention to the importance of engaging patients for patient safety while elevating their voices to achieve enhanced healthcare system for all. You will hear from the experts after the following report. I am Uche Ugochukwu.
Patient safety is a healthcare regulation that came into view due to the growing complexity of healthcare systems and the rise of patient harm in the healthcare facilities. It is therefore seen as the absence of preventable harm to a patient and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. Patient harm due to adverse events is one of the leading causes of morbidity and mortality worldwide. The available evidence suggests that hospitalization in low and middle income countries leads to 134 million adverse events annually, which in turn results in 2.6 million deaths. In high-income countries, approximately 1 in 10 patients is harmed while receiving hospital care. This harm made to patients could be medication errors, surgical errors, healthcare-associated infections, sepsis, diagnostic errors, patient falls, pressure ulcers, patient misidentification, among others. It is important to note that recognizing patient safety as a global health priority and as an essential component of strengthening health systems for moving towards universal health coverage, the 72nd World Health Assembly adopted Resolution WHA 72.6 and Global Actions on Global Patient Safety Day in May 2019. Thus, the World Patient Safety Day was established and became a global campaign that is built on a series of annual global ministerial summits on patient safety initiated in 2016, as well as the high-level advocacy and commitments of major international and national stakeholders. Since 2019, World Patient Safety Day has been celebrated across the world annually on 17 September, calling for global solidarity and concerted action by all countries and international partners to improve patient safety.
If you're just tuning in, you're watching Global Health Digest. Evidence shows that patient engagement reduces healthcare errors and costs and improves health outcomes, healthcare delivery, quality of care, and life. Are patients even aware of their need to be involved in their healthcare services? Our crew went to the streets to hear their experiences in hospitals.
Do you know you have a right as a patient?
No.
The people working in the hospital will tell you keep your right to your pocket, because I had the experience of a friend whose wife was pregnant in process of delivery. She went to the hospital. The doctor now said no, you should go back and bring and pay a certain amount of deposit. The husband now said no, please start treatment. Let me rush down home to my working place and get money. Before this man will come back, they throw the man outside. They throw the woman outside the hospital.
I have once been to a hospital. You understand? Then on reaching there, I demanded that let me see the doctor, the consultants. But in the case of that, I was deprived
Some people, they will get an emergency something that to attend to, but they will just neglect them on the floor. Some of them will not give them any attention.
When you go to government hospital, they will tell you you didn't come on time, that the doctors have gone. You would have come in the morning.
The doctors has to attend to me. It is my right, civic right.
Well, it is obvious both patients and caregivers need more enlightenment. Research shows clear policies, organizational leadership, capacity data to drive safety improvements, skilled healthcare professionals, and effective involvement of patients and families in the care process are all needed to ensure sustainable and significant improvements in the safety of healthcare. Director, Patient Safety Africa, Professor Sonny Isemade, furnishes us with the global situation.
Patient safety is of utmost importance because if you consider the statistics globally, you agree with me, it's worrisome. At the Yaoundé conference in September 2008, there was another call. This was the African Regional Conference on Patient Safety in Africa, Issues and Challenges. And that set out, plans of action that if we had instituted, if they had instituted across Africa, would have made, COVID less of a problem. And then this needed to be repeated in 2019. I'm talking globally now. So the World Health Organization in Resolution 6 at the 72nd World Health Assembly in 2019 really had to come back to ask member countries of the United Nations to recognize the issues, the global burden of patient safety everywhere around the world, whether in Asia, whether in Europe, whether in the Americas, it's a problem. And this time, there's something different happened. In 2019, following that resolution, the Director General of the World Health Organization was mandated to set up a project. So a plan was set up, unlike in 2002, and an implementation strategy was also followed. And this has helped many countries to be able to tackle the problems because they now have a plan, they now have an implementation strategy. Whilst a lot has been done in terms of research, in terms of data collection, in terms of the use of protocol, I would say that there's still so much to be done on the global scale because one patient harm care is one too many. And you will agree with me with that. Having said that, a number of countries have risen to the challenge. They have domesticated a lot of the template provided by the World Health Organization and set up policies in their countries and set up guidance for clinicians because at the end of the day, those are the co-face, those are the bedside, need to be supported with guidelines. It is those guidelines about how to take the little steps that make the big difference. We have seen that in high reliability organizations, in atomic energy, in aviation. There are tiny little steps you have to take to make this work. And the process of breaking this down into, guidelines by the bedside is what has made a huge difference. Examples, the reduction of catheter-associated infections, the reduction of surgical harm as a result of the World Health Organization surgical safety checklist, the use of the maternal early warning scoring system. All these together have really helped. And you have the bundles of care, have the sepsis 6 bundle. Working together has made a difference. And some of the best papers we've seen around the world, it's not about buying a new CT scan or doing something really out of the world. It's about people forming teams, taking care of non-technical skills, make the patient a part of the planning of care. We call it co-design and co-development of care. If a patient feels aggrieved, if a patient is not is satisfied with the care he or she has received, that patient has a right to give feedback, and it should. We encourage patients to give feedback. It is through those feedback that we actually improve care, so we actively encourage it. In terms of continuous quality improvement, without that, we do not improve. And the culture is changing around the world. It's no longer a blame culture, and neither is a blame-free culture. We have a just culture where people are actually encouraged to report, that is staff, and also patients are encouraged to give their opinions about healthcare.
Yes, Professor Isemade, quality healthcare is everyone's business. In line with Resolution 18 of the 55th World Health Assembly, which called for member states to recognize the burden of patient safety and to set up policies to manage them, Nigeria recently developed the first national policy and implementation strategy on patient safety and care quality. We engaged the National Patient Safety Desk Officer, Dr. Gilbert Shetak, on the content of the document and how it hopes to enhance patient safety. Dr. Shetak is from the Department of Hospital Services, Federal Ministry of Health.
For Nigeria, we are following the global action outlined by WHO. We want to develop a policy in that line as directed by World Health Organization. And this policy, when it's completed, or which is about to be finalized actually, will be presented at the National Council on Health, NCH, where all the commissioners of health will be there with the Minister for Health, so that this can be adopted, so that it can be implemented in Nigeria. We want a situation whereby the patient, who is the customer here in the healthcare services, can get correct and accurate care, and the care should also be on time when they get to the hospital. Not a situation whereby patients spend hours without being attended to, and a patient can come with a different problem and he will go home with another sickness. Oh, why not? Nigeria have so much hope of attaining that, because most of the issues that arose from patient safety are already imbibed in the medical practice in itself. Whether you are a nurse, whether you are a pharmacist, whether you are a radiographer, whether you are a lab scientist, these safety issues are actually being taught. I think the problem is that people have not been paying attention to it, and it's causing a lot of harm to patients in the process of receiving care. All we are doing is to bring attention to the healthcare workers that these things that you were taught in school is very serious. It is very important, because it has been affecting human life, and the different professionals should be able to adhere to the ethics of their practice so that we can reduce harm to the patients. But what we are doing here is to give voice also to the patients and the patient relation. If you believe that something has been done to you wrongly, you should be able to voice out. You should let the healthcare workers know that. Let me give you a brief story. Sometimes a patient will come to you and will tell you, oh, I have this problem, I have that problem, doctor. Then you finish that one, you ask him gently, or maybe you crack a joke and he feels comfortable. You now ask him, is that the only problem you came for? He will now tell you, no doctor, I have this other problem. What is this other second problem? He may, if he has confidence in you, he will voice out the second problem. And in most cases, you now find out that that second problem is actually the problem he came to the hospital for. But he was a bit shy and he couldn't speak out. But as you make him relax and comfortable, he actually voices out the major issue, which is the second problem, not even the first one. It's a multi-sectoral thing. Of course, we intend to do advocacy to communities, to traditional rulers, to state governments, local governments, and outside that, patient safety is looking at supporting Servicom with healthcare workers that will be together, so that we have a combination of Servicom and care quality teams, that patients will be, when they come to the hospital, of course there will be this advocacy to them while they are waiting to see the doctors.
Indeed, Dr. Shetak, all of us are partners in patient safety issues. To wrap up this discussion, a medical law expert and patient rights and safety advocate, Ebenezer Egwatu, gives insight into what patient rights are and where this right starts and ends.
As a patient, firstly, you have a right to information. Now, this information is information as to the nature of the ailment you're suffering from, the treatment options available. So it's not a situation whereby you come and they say amputation is the only solution. No. If it is word surgery, amputation or injection or other available options, you have a right to those information. Then you have a right to the cost of that treatment. So you do not just walk into hospital and treatment is being carried out on you blindly. You have no idea of the cost. Then at the end of the treatment you are slammed with millions as the cost of treatment. No. So you have a right to the cost of the bill. These are under your right to information. You have a right to probable side effects of the treatment option you have chosen. So at the end of the day, if a particular injection is likely to make you deaf in one ear, you should be told that the likely consequence or aftermath of this treatment option you have chosen, there is 50, 70, 30% chance that you might go deaf on one ear, so that you know. Now, these are under your right to information. You have a right to informed consent. Now, that is after you have been given this information. And in fact, back to right to information, the Act provides that it is supposed to be in the language the patient understands as practicably possible. Because if I speak and understand only Hausa or Igbo, and you have used your medical jargon to explain everything, I did not understand it. There was no communication in the first place, so you have not informed me. So now you see that there is need for interpreters. Now the patient will be allowed to decide for himself or herself what treatment option suits his belief, suits his pockets, suits whatever consequence his mind will permit him to carry. The patient, maybe on religious ground, can say, I do not want this treatment. So you have a right to refuse treatment. As a patient, you have a right to confidentiality of your medical information. So the persons who usually breach this particular right, I need to emphasize on it, are these agencies that supply house helps. You have a practice where the intending employer subjects the house help to medical tests, medical examination, maybe HIV screening, hepatitis B and C and all that. There is nothing wrong with that. But where there is a challenge is that the laboratory, after carrying out the test, instead of giving the test result to the original owner, who is the patient here, the intending house help or house boy, they give the result without the consent of the house help to the intending employer. So that is a breach of that person's rights to confidentiality. So you have a right to visitation, you have a right to safe, clean and secured healthcare environment. You have even a right to terminate your treatment at any point. But the hospital also owes you the duty or obligation to commence the treatment when you come back. If for whatever reason you say, I'm no longer comfortable receiving healthcare services here, terminate my treatment, the hospital will give you a form to feel that you opted to be discharged against medical advice. You can go out. But if you peradventure you change your mind and come back immediately, the hospital still owes you the duty to take you in and continue treatment. Now I have to emphasize this particular right. You have a right to treatment in emergency situation. Very, 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 very important. Now, that right does not say that you have a right, that provision doesn't say you have a right to free treatment or free medication. No. It says you have a right to treatment in emergency situation. In fact, Section 20 of the National Health Act provides that no hospital in Nigeria, I'm paraphrasing now, should refuse a patient or deny a patient treatment in emergency situation for any reason. Now, any reason could be the doctors are on strike. That's a reason. It is not tenable under this right. The doctor on call is not presently available. It is not tenable. You need to go and make deposit of XYZ amount before we commence treatment. It is not tenable. If it is an emergency situation, if it's an accident, if it's a woman in labor, if there is a snake bite, if there is a gunshot, if there is a cardiac arrest or heart attack, these are a few examples of emergency. Now, this law prioritizes the human life, saying save life first before you talk about bills. What we have obtainable in hospitals is, of course, that's the standard hospital protocol, that you take in the patient, document the patient by getting the patient to have a card, hospital number before assigning to bed and all that. But where there is emergency, the law says that such hospital or institutional protocols should be waived and the right of the patients elevated because it is an emergency. So you save the life of the patients first. At the moment you notice that your right has been violated, but before you get to sue, you don't just walk into the court and say my right has been violated, so and the court hands you damages. No, it doesn't happen that way. You need to know how to gather your evidence, because if you he who asserts must prove, and you prove with evidence. So if you do not have sufficient evidence, you will not get judgment in your favor. But once a patient notices or discovers that his or her right has been breached, the first step to take is to report to the hospital management. We call it administrative redress. So you write so that there will be documentation. There are supposed to be, or there are, Servicom desks. In every hospital in Nigeria should have a Servicom desk. So you write a letter of complaint, submit it there, get an acknowledgement copy. So you have now gotten a number one step. If the management looks at your complaint and they address it to your satisfaction, it ends there. But if you feel that maybe this goes further, you are not satisfied, then you can take it up to professional redress by lodging a complaint at the Medical and Dental Council. The procedure is that you go to court and swear to an affidavit. So and so, you get to court, they will guide you. You swear to an affidavit. At the Medical and Dental Council, complaints do not come by way of letter writing. You swear to an affidavit in court stating all the facts, all that happened, and why you think your right has been breached. Now, I want to assure you here, they will look into your case. When they receive your complaint, they will look into it. If they find prima facie merits, they will write you a letter, the complainant, and bring you in. They will also, the doctor you complained against or the healthcare professional you complained against, they will also send your complaint to the person to look at it and ask the person to respond to what you have complained about. When the person responds, they will also look at it. If there is merit in your complaint, the doctor will be invited to face the panel or the tribunal. That has happened repeatedly. Now, if you still do not feel satisfied, you go to the third level, which is a judicial or legal redress. Now, this one is two-pronged. We have the civil action, we have the criminal action. The criminal action comes in maybe where there is outright medical malpractice, a case of organ harvesting, which is a criminal offense, or outright malpractice, deliberate intention to harm a patient, which is not what the doctor is trained for. Now, if such happens and the patient suffers harm, the patient's word can bring a criminal charge against the doctor, but it is not in their power to do that directly. So there we complain to the police will investigate, and if there is merit in that complaint, the police charges the healthcare affected healthcare personnel to court, and he will be tried under our criminal law jurisprudence. For the civil, if there is loss of earning, if there is any other bodily harm but not intentional, maybe misdiagnosis leading to harm, maybe drug overdose leading to loss of organ, and a lot of things, a medical error generally, you can sue under our civil. It comes naturally under law of torts, because the doctor owes you what we call duty of care. So because the doctor was negligent, made a mistake, or was leading to harm, so you complain. But when you get to court, you have to establish, one, that there was a duty of care between you and the doctor. The doctor has breached that duty of care. As a result of his breach, you suffered harm. So based on that harm, you are entitled to damages or compensation by the courts.
Of course, always demand your rights as a patient, and do not hesitate to seek redress when needs be. That is it on Global Health Digest this week. Expect another interesting and educating episode same time next week. As always, take responsibility for your health. I am Uche Ugochukwu. Here are the tidbits.